Good evening. This is Robert from OutbreakNewsToday.com, and welcome to this Facebook Live. And again, I'm just going to do a little update on some new stuff. You may have already heard of some of it that's going on with the 2019 novel coronavirus from Wuhan City, China. And some of the latest news we got here is, I think it was last week, the World Health Organization twice declined to declare this a public health emergency of international concern. Well, the Director General, Dr. Tedros, announced that they will reconvene the emergency committee tomorrow, Thursday that is, to consider whether this novel coronavirus outbreak, epidemic in China constitutes a public health emergency of international concern. So we'll definitely be keeping an eye on that. It's not a big surprise. I mean, because the numbers have really been increasing pretty rapidly. More than 1,000 confirmed cases out of China on a daily basis. So the numbers are increasing pretty rapidly. And let me get to what was current as of January, as of Tuesday. And from the Chinese health officials, they reported there was about 6,000 confirmed cases in China and 132 fatalities. That's up about 1,500 from the day before when it was about 4,500 cases that are confirmed. There's the list of countries outside of China continue to grow that are reporting cases. And I'll go over a quick list, and hopefully I don't miss any. Hong Kong, Macau, Australia, Cambodia, Canada, France, Germany, Japan, Malaysia, Nepal, Singapore, South Korea, Sri Lanka, Thailand, Taiwan, the United States, Vietnam, and then during the course of the day today, we learned that there was a case in the United Arab Emirates, UAE, and as I sat down at the computer, I discovered there's a confirmed case and an imported case in Finland, so another case in Europe. Of course, and the National Health Commission of China will be releasing updated numbers, and they usually do it around 10 p.m. Eastern time where I'm at, so I'll probably report on that tomorrow morning. But of course, these numbers are probably far lower than what the reality is. And if you may remember he used to be the FDA commissioner in the United States. His name was Dr. Scott Gottlieb. He was on television the other day, and he was talking about the numbers of novel coronaviruses in China. And he said, this is what he said. He's worried that the coronavirus cases in China are actually much higher than the official numbers. Quote, I think we are dramatically underestimating cases in China by tens of thousands, he's saying. Gottlieb he's a physician and a health advocate. And he says it's really hard to tell the total number of people who were infected in China since health officials did not widely roll out diagnostic testing until later in this month. He says, we know the numerator, but we don't know the denominator. Last week he said there could be thousands of mild cases that would likely go undiagnosed and clear up on their own. So, and he's not alone. There's a lot of people that are saying that. There was a report from Hong Kong University earlier this week where experts there doing their techniques earlier this week said there was probably 44,000 cases in China. So, speaking of Hong Kong, they announced this week they have to take a very active approach to this outbreak, and they closed many of the border crossings with mainland China to try to contain the outbreak from spreading over the border into Hong Kong. Carrie Lam, she's the Hong Kong chief executive, said in a news conference that the closures of crossings into semi-autonomous Chinese city would be temporary. And Lam also said that Hong Kong will be slashing the number of tourist visas it's going to issue to people in mainland China. So they're making some efforts in Hong Kong to slow it down crossing the border. Then there was this gentleman his name is Mark Parrish. He's the regional medical director of Northern Europe at the International SOS. And he was on TV and he was talking about the virus and the extraordinary attempts that China has been making with their quarantine measures, however you feel about that. And he started talking about the virus a little bit, and he says, it appears that the death rate remains at about 2 to 3%. Putting it into perspective, 100 deaths or so far, all in elderly people, those who have other coexisting diseases, unfortunately. And those are the ones that are most likely to be affected by this, as their respiratory systems find it difficult to deal with these things. And Parrish goes on to say that the death rate is relatively low compared to other coronavirus outbreaks, right? The SARS outbreak in the early 2000s was about 10%. And of course, the ongoing MERS outbreak, that's predominantly in the Middle East, but it's been seen in a lot of other countries, has a fatality rate of somewhere around 35 to 40%. And of course, the 2 to 3% death rate he's reporting now, it's still very, very early in this, so we don't know where that's really going to level off at some point. And he goes on to say about 25% of people who get the virus become quite sick and require hospital admission. And unfortunately, a small percentage of them don't do very well and they die. And right now, the treatment is essentially, symptomatic treatment, since there's no specific treatment for the virus as of yet. They are working on a bunch of different antivirals and ones that are currently available to see if any of those can be used effectively with the novel coronavirus. And then I saw this, and by the way, if you're watching on Facebook Live, I would love to know where you're from. I say this every time, but it's always interesting to see who's watching and from where. So if you don't mind, go ahead and let me know. There was a study that was published recently by experts in population mapping at the University of Southampton, and they basically identified cities and provinces within mainland China and cities and countries worldwide that are at the high risk of, novel coronavirus spread, right? And according to their team, they found that Bangkok, Thailand is currently the city most at risk from a global spread of the virus. This is based on the number of air travelers predicted to arrive there from the worst affected cities in mainland China. Sorry about that. And it goes on to say, after Bangkok is Hong Kong, number 2, followed by Taipei, Taiwan, number 3. Other major cities that are in their top 30 include Sydney, Australia at 12, New York City at 16, and London at 19. They go on to say the most at-risk countries or regions worldwide are, in this order, the top 3 is Thailand, Japan, and Hong Kong. The USA is number 6, Australia is 10, and the UK is 17. And you can go on their website. It's called www.worldpop.org, and you can find the full listing of their findings or their predictions. Now, the cities within mainland China that are identified as high risk by the researchers include Beijing, forgive me for my pronunciation, Guangzhou, Shanghai, and Chongqing. So anyway, it's pretty interesting stuff. I encourage you to go check that out if you get a chance. That's at worldpop.org. So you can take a look at that. Back in the U.S., right, they've evacuated over 200 people out of Wuhan from the diplomatic corps and family members and stuff like that. And they are already, it appears they are already in California. So they basically did refueled in Anchorage, Alaska. The patients were checked up there. Now they're down here in California at one of the bases, again, getting risk assessment, being checked over by doctors and temperature checks and observation of respiratory symptoms. And I guess they're going to keep them for a period of time, 72 hours or stuff, in a hangar, from what I understand. And if they feel fine after that, I guess they'll be released. But if they don't, then they're going to be held or taken to a hospital at that point. So that's kind of an interesting thing, this evacuation of the U.S. consulate staff and others from Wuhan. And the U.S. isn't the only one doing that, right? I saw the UK is going to do it. Japan's doing it. Several other countries are getting their people out of Wuhan, the epicenter of this rapidly growing outbreak. Again, in the U.S., there was initially 3 airports that they were going to do public health screenings. That grew to 5, and now that's grown to 20. And I posted this on Facebook yesterday, I think. It gives you the whole list of the 20 airports that they're going to be doing screenings at. And it says, Scott Pauley of the CDC said that the 20 airports align with the center's existing quarantine stations that cover all 50 states and Puerto Rico. The stations are part of the CDC system for limiting the introduction and spread of contagious diseases in the U.S. So there is 19 airports in the U.S. and plus 1 in Puerto Rico. That's on this list. Okay, something I found pretty interesting is learning that all the crazy conspiracy theories and lies and stuff that are going on about this virus, and this, I guess I shouldn't be surprised. This is the type of occurrence that clearly would trigger that kind of stuff, but some of them are pretty unusual, and I want to go ahead and touch on some of them for you right now. And these are some that have been debunked. One, in Australia, apparently, multiple Facebook posts shared hundreds of times claim to show a list of foods and locations in Sydney which have been contaminated by the new coronavirus strain first discovered in Wuhan. It says on one post that was published a couple days ago, it identified different types of rice, cookies, onion rings that contain traces of the virus. It also claimed that a Bureau of Diseaseology had run tests and discovered the strain in several Sydney suburbs. So that's one crazy social media lie, conspiracy that's going around that's in Australia. There was also a video that was shown in the Philippines that was viewed almost 100,000 times on Facebook that said they were showing the market in Wuhan where the virus strain materialized. But checking on the video, we learned that it was actually a film from an Indonesian market. And what the footage showed was bats and snakes and rats and all these other animals being sold in a bustling market. However, they discovered that through the different techniques that are available, that it was actually from a market in Indonesia's North Sulawesi province. So again, another falsehood, fake news, however you want to call it. In Sri Lanka, there's a Facebook post that was shared thousands of times claiming that doctors were projecting that the entire population of Wuhan, a city of 11 million people, would likely die of the novel coronavirus. So, and of course, this is false, and Chinese authorities never made such a projection. And then there's some posts that's going on in different social media sites like Weibo and Twitter and Facebook that claim that top Chinese respiratory expert Zhong Nanshan told people to rinse their mouths with salt water solution to prevent infection with a new virus outbreak. Of course, this is bogus, and saline will not kill this new virus. So it's so stupid. It makes you want to laugh, but it's really, really tragic. There's a lot of people that believe this stuff. And it kind of brings me to a story I read today about from Google Trends that what people are surfing when it comes to the coronavirus. And it appears that a lot of people think it's linked to Corona, the brand of beer. And so beer virus and Corona beer virus are two of very large searches on Google, according to this report I saw online today. So then there's some conspiracy theories that are going around on Facebook and Twitter that are alleging that the novel coronavirus was created on purpose, with theories including that it was manufactured with the US CDC. Anyway, and there's a lot of people that, and even on this Facebook page, there's people that have been putting on this links to these patents, but these were actually patents that were registered in an effort to combat different strains of coronavirus, like for developing vaccines. And I think, I can't think of his name, Dr. Allen, he comments quite a bit on this Facebook page. He kind of explained that. So, and then there was just another one out of the Philippines, which I found amazing. And it was something that was going on through Facebook, saying that the 2019 novel coronavirus was actually a type of rabies that can be contracted by eating bats. And according to this poster, putting up this false information, say that people in China also eat dogs with rabies as well as dengue-carrying mosquitoes. And if dengue and rabies are combined, the result is a mutant illness, this poster added. So, yeah, just really, really crazy stuff going on there. No, the novel coronavirus is not a form of rabies. So just in case you weren't sure, it's not. And the last thing I really want to talk about is, right, we saw that Wuhan, now a whole bunch of cities around it, but Wuhan, a city of 11 million people, went on lockdown, right, in this effort. And that was the decision of that mayor of Wuhan. And I'll get to that in a second, but I think what we know now is it's close to 20 cities that are on lockdown with a total population of about 50 million people. And if you're in the US, that's kind of equivalent to shutting down the whole West Coast states of the United States. It's a real lot of people. Anyway, the mayor of Wuhan said on Monday that his administration's handling of the crisis was not good enough. And he offered to resign, according to a report. Quote, "If people want to pursue accountability about the lockdown and the public has a strong opinion, we are willing to step down," according to the mayor, Zhao Zhangwang. He said that on state TV. Zhao defended his decision to lock down the central city of 11 million people as an effective way to curb the spread of the deadly disease. But he also admitted, and I found this quite interesting, this is a report from, the New York Post. He also admitted that the city's government disclosure of information about the disease has been unsatisfactory. And there's been a lot of people making that claim that, China has been withholding quite a bit. Though I think I'm old enough to remember SARS. I think they're a little bit more open about this current outbreak than they were about SARS. So anyway, that's some of the latest news. And so we got a couple of new countries that have been reporting infections, right? We saw the UAE, and as I just mentioned earlier, Finland. As I sat down to do this, I saw information from the Finland Ministry of Health. So I'll be publishing something on that momentarily. And we also, one thing I forgot to mention, we do have some human-to-human transmission outside of China. And I can't remember all the countries, but I know for sure Germany, and Japan's had a couple cases. I believe Taiwan. I'm sure Baptiste will correct me if I'm wrong. And I think there's a fourth country, but it behooves me right now what it is. But anyway, so that's some of the latest on the novel coronavirus. And we're going to be waiting with bated breath tomorrow when the World Health Organization meets again to determine whether the emergency committee to determine whether or not this is a public health emergency of international concern. And again, I appreciate you watching. Let me know where you're from. I always appreciate that. And I'll see you next time that I do a Facebook Live. See ya.